And I'll now give the floor to the honourable member for Vancouver East.
Mr. Speaker, and first of all, I'd like to say that I'll be sharing my time this evening with the member for Bonarau Salaberry. Thank you, Mr. Speaker. Well, first of all, I'd like to thank you, Mr. Speaker, for agreeing to my request to have an emergency debate on this very critical issue of drug shortages in Canada. I made the request on Friday, and I'm very glad that the House has an opportunity to discuss this very critical issue. And I'm sure, being in our ridings and our home communities over the weekend, I have no doubt that many members of Parliament probably heard from constituents how concerned they are about this escalating drug shortage in Canada. Mr. Speaker, as we know that this shortage has been ongoing for a period of time, but it has, in the last month or so, become something that is now approaching a critical nature because of the closure of the Sandoz plant. We're also aware, Mr. Speaker, that this shortage is projected to last 12 to 18 months. And across the country, many regions have had to change their prescription strategies, to use replacements, often without experience about how they work, to limit elective surgeries. And as we gather information across the country and there are ongoing news reports, we know now that pretty well every province and region is affected. Mr. Speaker, I think we need to put on the record that this shortage is having the most serious impact on patients in intensive care units and those who are dying and in need of pain management. We know that hospitals in Quebec are cancelling elective surgery, and that hospitals in Ottawa are saying that they will probably have to do so in the next few weeks if their drug supplies are further depleted. And we also know that in Alberta, Manitoba and BC, they're also suggesting that they will have to do the same if the situation continues. Mr. Speaker, although I'm not a health expert, certainly from all of the information that we've had before us, we know that injectable opiates are the main method of pain control for surgery, post-operative care, and for any hospital admission. With the hospitals running low on these drugs, they are now being forced to cancel elective surgeries and to save the medications for severely ill patients and those who are needing serious pain management. We know, for example, that for patients in Alberta who are undergoing chemotherapy, they are now being asked to buy their own anti-nausea drugs because the hospital can no longer provide extra supplies. These drugs are very expensive. They can cost up to $13 a pill, and it's good to know that the provinces of Alberta has said that they will reimburse the cost, but still it puts patients at a great hardship and disadvantage. Mr. Speaker, right across the country there are stakeholders, healthcare interests who are speaking out, and I'd just like to read into the record some of what's being said about this crisis. For example, Dr. Rick Chisholm, who's the president of the Canadian Anesthesiologists Society, has been calling on the federal government to develop a strategy, a national strategy, to anticipate, identify and manage shortages of essential drugs. We know that the Ontario Health Minister, Deb Matthews, has said that Ontario didn't get any advance notice about the shortages, and in fact she points out that the provinces have no way of knowing when a supply is short because Ottawa, the federal government, does not require prescription companies, drug companies, to report gaps in supply. We know that the Alberta Health Minister, Mr. Horn, he has said, we're not going to stand by and simply wait to hear from Sandoz, which is the company that shut down, or the federal government. We hear from a specialist nurse manager in Vancouver who specializes in pain management, who says, we cannot understand how the federal government has allowed the supply of all injectable opiates to be threatened. From the Cancer Control Society, who have pointed out that Health Canada is the regulator of drugs. It approves and certifies drugs for sale and monitors safety and regulates the way drug companies operate. They also point out that other countries have taken much more action to protect patients, including mandatory reporting and inquiries to address the root causes, and they are calling for a plan that must focus on the needs of patients. We also know, Mr. Speaker, that the Canadian Medical Association did a survey more than a year ago where 74% of doctors surveyed said that they had encountered shortages of generic drugs, most commonly antibiotics. And we also know, and this is very concerning, that the Canadian Pain Society has reported that they're seeing an increase in people who are feeling suicidal because they are so concerned and worried about lack of medication that is something that they depend on every day. So, Mr. Speaker, we are facing an incredibly serious situation. There have been many reports over the years from the Pharmacists Association. The pharmacists have been sounding the alarm on this issue for a very long time. There's been media reports, and yet the response that we've seen from the federal government has been really, at best, completely inadequate and in fact, really quite pathetic. What has the federal government done? Well, Mr. Speaker, what they did was they set up a voluntary reporting system. And as we've heard from some of the provincial health ministers, setting up a voluntary system does nothing to require these companies to actually report information when they know that they're going to have a shortage. I think it is very interesting that in the United States, by contrast, in October 2011, President Obama issued an executive order directing the FDA to require drug manufacturers to provide adequate notice. And in fact, there's currently legislation in the American Congress to require, not just ask, all companies to give 6 months advance notice of potential shortages, punishable by civil fines for non-compliance that could reach $1.8 million under the bill that's being proposed. So, Mr. Speaker, we can see that, first of all, this problem is very widespread. It doesn't just involve Canada, but that other countries are taking much more serious note of what is happening and are actually taking are being proactive in intervening and ensuring that patients are not suffering. It's very sad and very disturbing to see that, unfortunately, the federal government and Health Canada have not taken this action in Canada. So I think it's very important that we have this debate to hear perspectives from different parties about the nature of the crisis, but also what it is that we believe should be done. And I would suggest, Mr. Speaker, that the first issue that we need to focus on is that Health Canada and the federal government do need to become much more involved in this issue. A voluntary committee is just not going to cut it. We know that the provincial health ministers are now having daily calls to try and sort out this mess and a very real threat that they face about what they're going to do for their individual jurisdictions and the hospitals that depended on these particular drugs that are now not available. So, Mr. Speaker, first up, I think it's imperative that Health Canada acknowledge and the federal government acknowledge that they have not been proactive on this issue, that to call for voluntary measures to set up a website has not done anything to mitigate the crisis that is now before us, and so they do need to take much stronger action. Mr. Speaker, we believe that there should be a review, there should be an inquiry about why these shortages are existing, and we should put in place a mandatory reporting system. This is being done in other countries. It is working, and I think there needs to be a much better explanation from the drug companies about problems that they may encounter, but also whether or not there are other factors at play here, such as mergers that are taking place, such as a focus on marketing more expensive drugs and in effect diminishing the supply of generic drugs. There's a very major issue here that requires investigation. So, Mr. Speaker, it's an important first step to have this debate tonight, to investigate what's going on, and to say to the federal government that more has to be done. All of the stakeholders in Canada, and some of them I've mentioned tonight, are calling for strong leadership and action from the federal government. And so I hope as a result of this debate tonight and the focus on this issue that we will see that action, and we won't see the health minister basically blame everybody else and say, oh, well, it's the drug companies, it's the provinces, it's the territories, it's their problem. This is all of our problem. This is something that requires our attention, and we need to focus on the needs of patients and make sure that people aren't left in dire circumstances without proper pain management and drugs that they require for what they're facing because of a shortage that can be prevented, can be managed, and that we can put a plan in place that will actually work for people. So, Mr. Speaker, I look forward to the debate tonight and the various points of view that are offered. Thank you.